Assalamu alaikum. The paper for this week is titled Anesthetic Efficacy of Gogate's Nerve Block, Inferior Alveolar Nerve Block, and their combination in mandibular molars with symptomatic irreversible pulpitis. It is a prospective randomized clinical trial conducted by Iranian group in 2018 and published by JOE. In general, effective local anesthesia is an important initial step in the management of patients with pulpitis. However, achieving profound anesthesia is a great challenge in mandibular molar, particularly in teeth with symptomatic irreversible pulpitis. As we all know, inferior alveolar nerve block is the most widely used technique to achieve local anesthesia for endodontic treatment of mandibular teeth. However, clinical studies have reported failure rates ranging from 30 to 81%. Another technique, which is called Gogate's nerve block, was first introduced as a true alternative approach to anesthetize the mandibular nerve in 1973, targeting the lateral aspect of the anterior portion of the condylar neck where the mandibular nerve exits through the foramen valley. However, also clinical studies have reported failure rates ranging from 10 to 65%. And I believe that the most probable explanation for the decrease in the success rate of local anesthesia in teeth with inflamed bulb can be the activation and sensitization effect of inflammation on the nociceptors and stimulation of a greater number of nerve fibers, resulting in a barrage of impulses from the inflamed bulb to the brain through more than 1,000 unmyelinated sensory fibers. Therefore, it is hypothesized that deposition of local anesthetic solution at different sites, resulting in improved efficacy of local anesthesia. This randomized clinical trial, aiming to compare the anesthetic efficacy of Gogate's nerve block, inferior alveolar nerve block, and Gogate's nerve block in association with inferior alveolar nerve block for mandibular molars with symptomatic irreversible pulpitis, and their null hypothesis was no difference would be found between the success rate of the two nerve block techniques and their combination. In their material methods, 150 patients diagnosed with symptomatic irreversible pulpitis were randomly divided into 3 groups. Each group received either Gogate's nerve block, inferior alveolar nerve block, or a combination of both, and the anesthetic used was 2% lidocaine with 1 to 80,000 epinephrine. Pain was assessed using a dental procedure using a visual analog scale, and the profound lip numbness was considered as a subjective criterion for nerve block achievement. The procedure's success was defined as mild or no pain during the treatment. The study found that the success rates were 40% for Gogate's nerve block, 44% for inferior alveolar nerve block, and 70% for the combined Gogate's nerve block and inferior alveolar nerve block technique. And the combination of both techniques was significantly more effective than either technique alone, but supplemental anesthesia was still required in some cases. So in this study, it is providing valuable insights into improving the pain management for patients with difficult to anesthetize teeth.